Hello, and welcome to Let My People Eat, a podcast that provides satisfying talk about kosher nutrition. Here we clear through the clutter of nutrition speak, arm you with the clarity and confidence to eat, feel, and be your healthiest every day. I am Jill Sharfman, a board-certified holistic nutritionist living in Los Angeles.
And I'm Dr. Andrea Moskowitz, a neuroscientist and psychiatrist in Los Angeles. I use my training and experience to integrate positive lifestyle changes into my patients' lives.
Hey, Andrea.
Hey, Jill. How's it going?
It is going well. We are still here under lockdown in LA, but thank God the weather's great and we can go outside. It's lovely. So I have a question for you about your practice.
Sure.
Do you see a lot of people from the Orthodox community, or have you seen a lot of people from the Orthodox community?
Yeah. I have in the past, and I see some now. What was a further question about that?
Yeah,
no, I do. Yes,
you do. And do you feel like there's any, like they prefer seeing you because you are Orthodox, or do you think that maybe hinders a little bit?
In general, it doesn't hinder. What I think hinders more is and a lot of times people want to see an Orthodox Jewish psychiatrist because of various things they're told. They're told only go to an Orthodox mental health professional, which I think has its pluses and minuses depending on what your issues are. You know, I think the biggest problem is the stigma with mental health issues, which is present in the general population, and it is very present in the Orthodox community. Like I said, I think in the population at large, there's a lot of stigma about mental illness. It's getting somewhat better, especially for certain kinds of things, but it's still very much present. And the statistics are, most people with mental illness, depression, anxiety issues, whatever, never go in for treatment.
Right.
So they're very undertreated, and they can very negatively affect the person's general health also.
Right. So I definitely want to dive deeper into this because
yes, I think it's very important
in our community. I think it's getting better than it has, but we have a special guest with us today. Dr. Rona Miles is a licensed psychologist who obtained her doctorate from Yeshiva University. She is a professor in the psychology department at Brooklyn College, where she teaches clinical courses and is the deputy director of the graduate program in mental health counseling. Dr. Miles maintains a private practice and has worked in both clinical and educational settings for the past 25 years. Hi, Dr. Miles.
Wow.
Hi, Dr. Miles.
A nice introduction. Thank you.
Such a pleasure to have you on here today.
Thank you for having me.
There was a study that I was reading by Drs. Feinberg, the mental health needs of the Orthodox Jewish population, metropolitan New York. And they say that when they surveyed Orthodox mental health professionals like yourself and Andrea, 72% of them felt that the fear of stigma was the most important factor in the reason why the Orthodox Jewish community does not seek out mental health care. Do you find that to be true? That number is really so high?
I'm not going to address that particular number. I would love to read that study. Okay. But if you're asking me in general, the fear of stigma is really, really high across many communities. And I find that even more so in insular communities. It's like when you have an insular, close-knit community, when people know what's going on in each other's lives, and they're more close-knit, and people are more concerned about the judgment or the label. And so, I can't imagine that it's that high. And that would be like one of the foremost reasons that somebody would be, reluctant to seek the help that they needed. That I think that in any insular community, where it's tight-knit, where people know each other's business, where people are more, aware of maybe what someone else is doing, that there's more of a fear that I will be labeled or I will be judged, or this label or this diagnostic label that's on me would be then used to prejudge me in a certain way. And so I think that a piece of it, but I want to know what you guys think also. I think a piece of it is the insularity and the close-knit nature of our community that, causes the stigma to be, high.
Right. I would agree with that. And, what I've found also, I'm sure you found this too, when I people evaluation or whatever, they're like, no, you can't diagnose me, or don't diagnose my kid, or they can't go on medication. And the reasons they'll bring up is because of like shidduchim,
right?
Or they'll bring up shidduchim for the siblings of the kid, or shidduchim for their kids, or for the, and it's sort of like, no, like even something that's very treatable, you can deal with very well. They're like, no one can ever know. I can't, because then I'll have to, reveal it, and it'll just negatively impact all the rest of my life.
Right.
Right.
So it all
that makes it very stressful.
It all comes back again to shidduchim somehow. It seems like a lot of our conversations do.
Right.
I think the label is so frightening. And that's why, when you think about what the definition of stigma is, which is that you'll have a label and then that will be like a mark, and that somebody will judge you based on that label, will make generalizations based on that label. That's why that label, or that diagnostic label, like depression, bipolar, drug use, that label becomes something that's so frightening to people in an insular community, or frightening to people across the board.
Right. And I also think a lot of people, like, they don't have that much education about mental health issues. I'm not going to even say mental illness, mental health issues, because really, like, the percentage of people who get a major depression is very high. It's like 17 to 20%.
Right.
That's a lot of people.
Right. That's a lot of people.
That's a lot of people. It's not like it's uncommon.
Right.
It's probably more common than diabetes.
Right.
Right. And, I think it's also this is hopefully going to evolve over time.
Right.
Because, back in like the 1700s, whatever, seizure disorder was viewed as you were, possessed by the devil.
Right.
There was like a sort of very moralistic tone to that.
Right.
And I think over the years, that also has happened in the past to mental illness, not as much now, but to mental illness. And I think there's still some of that taint clings to it.
Fear. I think there's fear, something that people don't really understand. And I think a lot of times they think, I've heard this, and I'm sure both of you had in their practices, that people are engaging in these behaviors because they're making a choice to engage in these behaviors.
Right. Exactly.
Yes.
And there's this misunderstanding that, no, this is, what you're supposed to be doing. So, you're not practicing this way or observing religiosity this way because you don't want to, but there are other issues at play. So it sounds like I'm hearing from both of you, educating the community is a big part of what needs to happen right now, and make people understand that there is help available, and this fear is maybe not justified in every situation.
So I want to address that for a moment. I think that if you look at the literature, the main cause of stigma is exactly what you just said: the lack of education, the lack of awareness. Right. But somehow, when I hear that, I think to myself, is that really something that we could do to decrease stigma? Is that the way in with the frum community? Is educating about what depression really is, or what bipolar really is, going to then decrease the stigma? I think that might be a piece of it, but I think the other piece is what we said before, that even if we increase awareness and teach, this could be something physiological, or this is not something that's someone's fault, I still think that the label, meaning even if we educate, I still think the label is one of the biggest sources of fear or stigma within the frum community.
Interesting. But both of you would agree that maybe over the last 10 years, the stigma has decreased somewhat. I don't know across all the communities, maybe the more Haredi, the more religious communities. I feel like the younger, I just see the millennials now are very open about their mental health issues, and they actually want to talk about it. So I don't know what you've seen in your practices, if you've seen this shift, and does it apply to all the communities?
Sure. So we've come so far. I mean, we can go much further, but we've come so far. I mean, you hear people now saying things like, oh, I'll talk to you later. I got to run out. I have an appointment by my therapist. Or, I'm looking for a therapist. Do you know of anyone great, nearby, or someone who specializes in ba-da-da, we didn't really have that 20 years ago. I would say 10 years ago, we didn't have that. You even have now people on social media who will say something like, let me talk to you about my experience with my therapist. And I think there's such an open tone, to even sharing one's thoughts about therapy or one's experience in therapy that we've seen lately. And Jill, I love that you said you see it a little bit more in like the younger kids, more of an openness, So,
And I think what's helped too is that more, I've seen this, I'm sure you've seen this too over the last 20, 25 years, right? More Orthodox people have gone into the mental health field.
Right.
So there's more Orthodox therapists. There's still not enough Orthodox psychiatrists. There's not
That's true. That's true.
There's not enough child psychiatrists, period. Right. So, But, and that's like a different pathway, but there's many more Orthodox therapists.
Right.
So I think that's been extremely helpful.
Right.
And people then become more comfortable with going, and they see it's not such a scary thing. I think the other thing that's helped too over the last 25 years, when I came into training, it was sort of at a transition point, going from sort of the old analytic framework to more of like a more cognitive behavioral framework.
Right.
And I always say, like, a lot of cognitive behavioral therapy, if you open up Pirkei Avos, you can find it in there. Right. Maybe not organized the way you want it, but for cognitive behavioral therapy, but it's in there. So I think for a lot of people in the community, that sort of approach is just much more comfortable, and it feels much more familiar than the old analytic approach of repressed desires and urges and all the sort of psychosexual stuff, which I think for our community is a real turnoff. And also may not be very accurate. It's not very helpful often. But, so I think
go ahead.
I think that sort of kind of, and it's not that insight-oriented therapy is not valuable. I'm not saying that, but in a different way. So I think kind of going from that old analytic mode where you went in 4 days a week and laid on the couch, and which I think a lot of people in the community were not at all comfortable with, to a more of a cognitive behavioral therapy with some insight-oriented added. And interpersonal stuff just feels much more comfortable, familiar, and practical, and it makes sense.
Okay, so I want to address that because I have really strong feelings about that.
Yeah.
I see a big bridge between the psychoanalytic type of therapy that we're talking about from the 50s and 60s, lying on the couch, and a more modern day psychodynamic approach.
Which is fine.
So, yes, some people are much more comfortable with a CBT approach. They feel it's more practical. They see the challenging of their thoughts, the change of behaviors, and the goals. But I do know that there is a large group of people that really want the new type of psychodynamic psychotherapy that branches off the old analytic therapy. So it's still like the insight-oriented.
Oh, sure.
Looking at underlying feelings, unconscious, subconscious, but in a more modern way. And so I do see a lot of people still gravitating towards that. Like some people tell me, I much rather the cognitive therapy or the CBT, cognitive behavioral therapy, but I still have some people who say, no, I want to get to the underlying stuff that's going on.
Right. Yeah.
So if I was going to see a nutritionist, I might choose somebody who's struggled with their weight, who's maybe gone through some of the choices that they had to make, lifestyle changes. I'm wondering if that applies in this situation. Do people really prefer someone who knows their lifestyle, knows their orthodoxy, knows the type they're struggling with, or would they prefer somebody who maybe is a little bit outside the community and who's not as involved, or is it both?
I just want to say one thing for a second.
Yeah.
I think that you had thought that Jill was going to ask the question of, because I thought so too, and I saw in your face, I thought you were going to ask if a person, just like you said about the nutritionist, you want somebody who had a certain lifestyle, who lost a certain amount of weight. I thought you were going to ask if people, look for a therapist who has struggled with similar issues to them.
I was thinking that too.
I think that goes back to the old dictum that whoever goes into that field is like, that was an understanding.
Oh my gosh, are you saying that to us?
I don't know. That's something we've always heard, but no, I mean, that's a separate question.
Yeah, you're asking about the being from the community. Okay.
Right. Because I mean, it could go, in my book, it could go either way. You want somebody who wants the deep understanding, or, maybe you don't want somebody who knows it at all and can come in with a fresh and new approach and isn't going to be biased in their treatment of you.
Right.
I see the same thing. I think that, people, balance out both sides. They say, if I went to somebody who was Orthodox, if I went to somebody, in my community, then I won't have to explain everything to them. They'll get me, they'll get my issues. I could just say a word like stress with blank and they'll get it. I don't even have to waste my session on it. I just dive right into the issue. And so people relate to that and they say, I really want to be able to connect with somebody who gets what I'm going through, gets my life, gets the community. But then you have the same people struggling and saying, but I'm concerned that if I go to someone, especially from my subgroup, maybe I'll be judged. What if, there's more stigma if they know who I am? Maybe I'm better off going to someone far away, going out of the community, somebody who's not from my circle, someone who I might not bump into, at a wedding, at the grocery store, something like that. And I think that sometimes you will have some people who will say that they're going to find the middle ground and they'll choose someone who is Orthodox but far away. Like they'll do that if they can, and this way they keep the person who gets their community. They get to work with someone who gets, the frum world, but they go out there because they're scared of the stigma of staying within the subgroup.
Right. Makes sense. Do you treat people who are also who have gone off the derech, so the people who've left the Orthodox fold, and is there a difference there? Do you see more issues with those people who've left?
So here's the thing. I definitely work with, individuals who have gone off the derech. It's so interesting that you're saying this because I'm actually in the midst of a research study coming out of Brooklyn College on individuals who left. And it looks at a lot of different aspects in their life, their perspectives, their experiences. My other research programs have been about mental health, especially in young adults, college age population, individuals in their, 20s, 25, 30. But I've branched out into this new research program on off the derech individuals. But I can't answer that particular question that you answered me. That's a little bit too multi-layered.
So we might have to have you back once you're studying.
I will tell you what's happened to me, and I don't know if this happened to you, Dr. Miles.
Yeah.
I used to see I saw adults too, but I saw children and teenagers, right?
Yeah.
So every so often I'd have parents bring me their kid, and it's almost like fix them. It's like, they're going off the derrick. They're going off the derrick. Like, you need to like get them back. And I'm kind of like, that's never a position a therapist wants to be in.
Right.
You know, and I'd be like, well, I can talk to your kid. I can see what's going on. I can help them understand things. I said, but I'm not guaranteeing. I said, I'm not like the Orthodox Jewish enforcement squad.
Right.
You know, we have to see what's going on, what they're questioning. And, you know, sometimes it was just a kid who was daring to question.
Right.
You know, right away they got labeled as, oh, you're going off the derrick. And it's like, I remember meeting with one of these kids, and I asked him, okay, so he was like 16 at the time. I said, so where do you see yourself like 10 to 15 years from now? Right. And he says, I see myself married, maybe have 2 kids. I said, okay. He's telling me what he wanted to do. I'm not going to give too many details. And I said, okay, where are you? Let me ask you something. So where would you be living? He said, it would be nice to live in Los Angeles, where I grew up. Okay. Where do you see you're sending your kids to school? And he mentioned, now not the yeshiva he went to. So it was a little bit more modern, but not really modern. He mentioned an Orthodox Jewish yeshiva. That's where he really saw his kids, sending his kids to. And I met later with the parents, and I said, you guys need to relax a little bit here. Yeah, he listens to rock music. Okay. Yeah, he reads some books that maybe you wish he didn't read. They weren't that bad, to be honest with you. They just weren't Jewish books, approved Jewish books, you know? I said, but you got to relax. What you're doing is you're just going to push him off and off and off. I said, he has no intention of going off completely. He may not be as Orthodox as you are, or he may. But even now, at part of the height of his rebellion, he never saw himself really leaving. And I think sometimes there's that, like, to jump in, parents are so scared that they end up almost, I'm not going to say producing what they fear, but
the self-fulfilling prophecy.
It's almost becomes a self-fulfilling prophecy. And I was always very clear to let parents know, like, I can talk to your kid, you know, but I am not going to enforce. I'm not going to tell them that they need to become back to the level that you're at or anything. I'm just here to listen to them. And I think sometimes, I found Dr. Miles, and I find this actually even in a non-Jewish population, there becomes a confusion sometimes when you're dealing with teens and young adults, maybe, that people confuse that you're going to like kind of get their kid to do something that they can't. Right. And it's sort of like, that's not my role. My role is to listen and empathize and try to help if they're dealing with depression or anxiety or things like that. But it's not my job to be like the law enforcement.
Right. I would like to add something about the OCD kids and take it back to what we were speaking about before regarding stigma. We have been finding over here that there is a lot less stigma in the last 10 years when it comes to having a child who is OTD. There has been a lot of movement towards acceptance of the choices that the kids are making, including these kids, you know, in regular life as part of a family. We have seen tremendous movement in this area. We have some really, awesome people in the community who have educated parents and, you know, and I guess worked with parents to try and show them, you know, this should not be the way it was many years ago where it was like OTD is like, you know, oh, we got to be really scared of that. So I'm wondering, have you seen that also? Because I've seen that here, you know, with a lot less stigma in that area that talks back to what we said before, possibly the increasing of education, the teaching of certain things that were considered like, oh my, you know, that has decreased the stigma with having a member of the family that's OTD. I'm wondering if you see that decrease of stigma in that area too.
Yeah, I think it's decreased, but I think it's still there.
Okay.
I think it sort of depends where exactly in the community you're looking.
Yeah.
You know, and I think it just depends. It depends on the family dynamic also.
Yes.
So I think like in a fairly decently functioning or a good enough functioning family, I think you're right. But then there's a lot of families that aren't. So it becomes much more of an issue.
Well, people, we are going to keep working towards decreasing the stigma across the board.
Right.
That's one of our biggest goals as, psychologists, psychiatrists. I think so.
Thank you. And there are other like groups that if people want to reach out to in the community, like I know Adumim does a lot of work, because Kanu, right, that I'll put links on the website to some of these places that people can reach out to if they're struggling.
I think it's also helpful. I'm sure this happened back east also, that a lot of the organizations that deal with other issues, so for example, High Lifeline, or Ateris Avigail, or Sharsheret, as they don't just offer help with the physical issues or the kind of psychosocial issues, they also offer help with counseling. And for family members too. So I think that's also helped decrease the stigma in that it's seen as a valuable part of a whole person treatment.
Oh, I hear that. Like it's different components, and that's just one.
Right. We could call it holistic.
Right. Yeah. So it's sort of, it's in there, and it's in there for the family members that are struggling, along with the person who's the primary patient.
Right.
So I think that's helped a lot also, I'm thinking now, with the stigma.
Right. That's great. So it sounds from both of you that mental health care in the Orthodox community has come a long way in the last decade, but there's still a lot that we need to do. And I thank you both for going and trying to help people and doing studies and, just educating us more about this. So
can I say one thing? Or
absolutely. No, you go right ahead.
I'll say one thing. This is an area that's very near and dear to my heart. I think that it's very important when people are looking for a therapist to keep two things in mind. I think one thing that they should keep in mind is, do I have this connection with this therapist? There's something called the therapeutic alliance or the therapeutic relationship, which has to do with feeling a connection, a sense of teamwork, a sense of trust, and a connection with the therapist across many areas. And I think that a person feels when they meet with a therapist, is this therapist for me? Do I feel that connection? But I think some people feel like once somebody recommended someone or they already went to that therapist for 1 or 2 sessions, that they don't want to start again. But I think that our gut is good and we get it. And if we meet someone and that therapist works for us and we feel that connection, then that's really something that really contributes to success in therapy. If you really look at the research, one of the greatest components that is associated with success in therapy is this therapeutic alliance, this therapeutic relationship. And so I think it's really important for people to know that it's okay. It's like, in a way, the way you find a therapist is the way you look for a partner in many ways. You don't just take the first one that comes your way. It's okay for you to say, this therapist didn't work for me. I'm going to look for another therapist. So sometimes people walk out of therapy and just give this blanket statement of, therapy is not for me. It didn't work. But really what it is you maybe needed a different kind of therapist, and maybe you needed a different connection. And I'm not saying that you should be jumping from person to person, but there is a certain sense where you can rely on your own feelings of, is this working for me? Is this therapist the right, match for me?
Yeah. So that's so true. That's really true, because everybody does have different styles and different ways of connecting, and somebody might need somebody who veers more towards the sympathetic mode, or somebody who might be a little tougher. So I totally agree with that. So great advice to leave us on.
That's excellent.
So thank you so much, Dr. Miles, for joining us today. We really appreciate it. We'd love to hear what happens with your study that you're doing in college.
Yes.
Sure.
And thank you.
It was so nice being here. Thank you.
Thank you. So
don't
forget to follow me on Instagram at Jill Scharfman. I also want to thank our engineer, Mike Cassantini at the Network Studios. And thank you again, Dr. Miles.
Thank you.
Thank you, Jill. Thank you for having me.
Thank you.
And that is it for this episode of Let My People Eat. Please visit our website at letmypeopleeat.com and leave us a comment. Get in touch at our email at podcast@letmypeopleeat.com or call us at 317-659-0004. Post on Instagram, Twitter, or Facebook with the hashtag #LetMyPeopleEatPodcast. If you like this show, please make sure to leave us a 5-star rating and review on iTunes. Tell your friends and family, and subscribe to us on Apple Podcasts.
And please remember that although we are certified professionals, this is not a medical advice podcast. No content, posts, or comments should be interpreted as professional guidance. Always speak to your own health practitioner about making the right life changes for you.
Until next time, I am Jill Scharfman.
And I'm Andrea Moskowitz.
Thanks for joining us.
And go in good health.